Today on the Doctor's In, we're going to go over our Cyano Kit. There's a couple of little changes that we've got due to some contamination issues that are going on. The company has issued a statement stating that we can use a 0.2 micron PES filter, which I will go over. We're also just going to go over how to use the Cyano Kit again, just for those of us that haven't used one on a frequent basis or maybe not at all in the field. So you'll have your whole kit that comes out. You take it apart, some important parts of it. This is going to be the micron filter. These may be issued separately from the actual kit itself. Within the kit, you will have a vented drip set. You will have your actual medication from the Cyano Kit, which is a hydroxycobalamin for the injection, which technically will turn into a B12 vitamin that's excreted after it absorbs all of the cyanide in the system. And most importantly, this transfer spike, which you will need to reconstitute the Cyano Kit itself with 200 mLs of normal saline. So you want to start with getting a 250 bag of normal saline. You pull our blue side off. So you'll start with your 250 ml bag of normal saline. You're going to be getting 200 mLs out of this. If you look at your Cyano Kit, on the bottle itself, there is a fill line. Come over here, pull your blue tab off, open up your transfer spike, pull your caps off both ends, insert the transfer spike into your 250 bag, pop your cap off of the Cyano Kit itself, and then insert that into the Cyano Kit. That was right up against my mic. Now that this is pre-poked, let's reshoot that part.
No, I don't think you need to. It's fine.
Okay. Okay. So once you've got your spike inserted into your Cyano Kit, again, you're wanting to put 200 mLs of this normal saline in there, filling up to that fill line right there. Okay, now that we've got our 200 mLs of saline in here, up to that fill line again, you can go ahead and pull the transfer spike, set the bag off to the side. And you want to gently rock this back and forth. You don't want to shake it. A gentle rocking to mix it is all you need. Otherwise, you're going to get too much air inside your bottle. And being a glass bottle, there's no way to bleed it out. Now that you've got that mixed up, you're going to come over here to your drip set. Again, this is included inside of your Cyano Kit. Now that we've got our bottle from the Cyano Kit mixed with 200 mLs of saline, we're going to get our drip set that's included within the kit. Remember that this one is a vented drip set to allow for flow out of the glass bottle. You're going to spike that as you would normally. Slow flow at first. If you open up and do not get flow, remember to open your vent up top. You can give this a little squeeze to prime it, and it should start flowing for you. Now once your line is primed, go ahead and shut everything off. This is how we normally run our Cyano Kits. So up to this point, this is normal operation on how we all know how to run a Cyano Kit. The addition to this is going to be the inline micron filter due to the contamination concerns that are coming from this batch of Cyano Kits. All you're going to do to attach that filter is come down to your normal inline port where you would go to your patient access side. You're going to screw the filter side directly into what would be the patient access side, and then again flush that pigtail. So once you've got your inline filter attached to your tubing, you're going to want to flush that as you would anything else. Come up here and open your stopcock. Let it fill the filtering chamber. As it flows through the filter, it will then provide your patient with a decontaminated form of the medication. I know we'll probably have some questions on the legal considerations that are involved with this, so I'm going to read that off to you from SERB Pharmaceuticals. Serb Pharmaceuticals, the manufacturer of the Cyano Kit, has acknowledged that there are sterility concerns in certain batches of the Cyano Kit. The use of the 0.2 micron inline filter during administration of the Cyano Kit reduces potential contaminants, as we would normally closely monitor your patient. Be aware of signs of systemic infection or sepsis post-administration, which is something we would typically see in a hospital setting, not the EMS setting. The receiving staff at the ER needs to be made aware that these patients need to be monitored for signs of systemic or sepsis post-administration from the Cyano kits, and why. The legal considerations for healthcare providers from Serb Pharmaceuticals read as follows. First, adherence to guidelines following the manufacturer's recommendations and any additional protocols set by health authorities demonstrates compliance with the standard of care. 2, informed consent. When feasible, inform patients or their representatives about the potential risk associated with the contaminated batches and the measures being taken to mitigate the risk. Documenting this discussion can provide legal protection. Obviously, you want to also discuss with them the risk of not administering a Cyano kit if they are suspected of smoke inhalation or cyanide poisoning from that smoke inhalation. As always, we want to document and maintain thorough records of the decision-making process, the batch numbers used, administration procedures, and patient monitoring. The detailed documentation is going to be crucial in defending against any potential legal claims. And fourth is regulatory compliance, which is stay updated with guidance from regulatory agencies and professional bodies regarding the use of compromised medical products. Non-compliance can lead to legal repercussions. Again, this is coming from Serb Pharmaceuticals, so this is what they have found to be the best solution for mitigating the risk involved with using these possibly contaminated batches.